Muhammad Sufi Abdul Ghani. Silakan. Tak apa, we just warm up.
Has start their journey by crawling out of their nest very deep under the sand and moving quickly towards the sea. They have to face many threats.
And of course, we have Dr. Amanda 𝐏𝐿𝐒𝐿𝐒𝐿, yeah? A warm welcome. Okay, well, we're going to start the forum, Fit for Diving, yeah? And of course, our moderator is Dr. 𝐏𝐀𝐍𝐄𝐋. I am a UMMC Sports Medicine Clinical Specialist with a master's degree in the field of sports and exercise medicine, yeah? A doctor with a passion for the great outdoors and keeping active for health, with more than 10 years of clinical experiences, as well as first-hand research experience on cardiorespiratory, fitness and recreational diving. I am committed to improving health and fitness through applied medical knowledge. Right, Dr. Amanda 𝐏𝐿𝐒𝐿𝐒, MBBS, MMMC, MSP, MED, UM, yeah? Represented MMMC for volleyball in 2006. Yeah, that's why I say very memorable. Moneyball. Yeah, that's right. The engineering college is just next door, yeah? Medical engineering. They're just side by side. Yes. Okay. And of course, represented MMC Sabah chapter for Interprofessional Bodies Volleyball, bronze in the year 2018. Winner of Women's Futsal Team for Sports Medicine Yearly Futsal Competition. Participated in Medical Outreach Program in Kota Marudu, SK Mangkapur Ranau, and Kampung Kiwayan Ranau Sabah. And of course, an avid hiker, scuba diver, and runner, MMA Ordinary Member, and MASM Lifetime Member. A little bit of intro, yeah? And now, the thorn among the roses. That's you. No, I don't want the chapter, yeah? All right. Muhammad Sufi bin Abdul Ghani, sports and exercise medicine physician, yeah? Right? Adept medical doctor with 12 solid years of practice experience, dedicated to exemplary patient outcomes and following all necessary medical procedures with the use of the updated medical evidence based on technology, yeah? Strong focus on listening to and addressing patient concerns and answering all questions in terms patients can easily understand, willingness to work with all members of the medical staff and listen to the suggestions and input to improve results and maximize patient satisfaction. Right, completed as Sports Medicine Master Program and become the sports and exercise medicine physician, providing me with knowledge of a range of health issues that impact the muscular skeletal injury, healthy lifestyle, non-communicable disease, and sports coverage. Right, if it's too techy in medical terms, we will try our very best, doctors, to simplify. Right, so without further ado, it's over to Dr. 𝐏𝐀𝐍𝐄𝐋, our moderator. Silakan.
All right, thank you for the MC. An honor. It is an honor to have him as an MC, actually. I've seen you from last year, and he tells me, oh no, I've been here for the past 12 years. So big round of applause for our MC as well. A veteran MC, I'm supposing. All right, so welcome. Assalamualaikum warahmatullah. Very good evening to everyone who's listening or maybe just beginning to listen. So I'm Dr. 𝐏𝐀𝐍𝐄𝐋. I'm a sports medicine specialist with UMMC. So myself, not as veteran as our beloved MC, but this is already my 3rd year here in MIDI. And I'm very honored this year to have my 2 colleagues join me this year. So on my right, we have Dr. Muhammad Sufi. And on my left, we have Dr. Amanda 𝐏𝐿𝐒𝐿𝐒𝐿. So this year, we thought we'd do something different. Rather than just me talking, I've invited people who are more qualified, more experienced as well, to join this stage with me. So what we're going to talk about this year is Fit to Dive, or fitness for diving, optimizing your health for maximum dive enjoyment, right? I don't think fitness is a topic that is much talked about among divers. People go to relax. It's a very leisurely activity. But there's definitely a role for it, or is there? So we'll wait for the panels to weigh in. So maybe we'll start on the right. Dr. Sophie, I know the MC gave a very long, detailed CV, but maybe just brief it and sum it up. Tell us a bit about yourself.
So, based on the question, Dr. Nadira asked me about myself and also how I get into diving. First of all, hello and a good day, everyone. Ladies and gentlemen, thank you for joining us today. I am Dr. Sophie Ghani, a sports physician from Hospital Taiping. Thanks to the moderator, Dr. Nik Nadira, my senior during my master training program in University Malaya, and hello also to Dr. Amanda, my batchmate, who shares the same passion flying into the blue ocean. So, frankly speaking, I've been in love with water activities since my childhood. Okay, so I explore and traveling to the other place, mostly the beaches and waterfalls. And there's one day in Turkey, I read somewhere there, they said that human only manage to explore the ocean floor up to 5%. Okay, so until now, there's the remaining 95% of the ocean floor still mysterious. Since then, I've been triggered to know and deep down to the oceans what is so fascinating and mysterious about the oceans rather than do a snorkeling. So I enrolled with a party for the open water and then proceeded with my advance, and I continued with my diving journey. The more dives that I completed, the more deeper passions with the scuba diving. And the scuba diving has taught me to become more disciplined. You have to wake up early in the morning. And scuba diving my thoughts become more organized and systematically. So you have your checklist, your body system, all the things, and also to respect for the nature. I pass back to Dr. Nadira.
Right, thank you for that lovely introduction of how he got into diving. So maybe Dr. Amanda, you can also share a bit about yourself and how you yourself got into diving.
Okay, thank you, Dr. Nadira, and also thank you, Dr. Sophie, for sharing your experience. So thank you, ladies and gentlemen, for joining us today. I am Dr. Amanda. I am a sports medicine physician in Hospital Tuanku Jaafar, Seremban. So I have 13 years of medical experience, and out of those 13 years, 8 years were based in Sabah. So that is where I took up scuba diving. So far, for my personal opinion, there is no who comes first or who comes last in diving, who has many more years in diving, but to be safe and also to be able to enjoy diving is actually is the main important thing. So I hope that whatever we have shared today is beneficial for you, and you can actually practice it in your diving so that it is a more enjoyable experience. Thank you.
All right, thank you for the introduction. So maybe we'll dive straight into the topic. So Dr. Amanda, maybe you can share with us a bit about what does it mean to be fit to dive, or what does this term fitness for diving means to you?
So in my opinion, fitness to dive actually has two main components. The first component is medical fitness to dive. So medical fitness to dive means the responsibility of the diver itself to go through the checklist and also to declare their medical condition, and also to identify any worrying symptoms that require any doctor clearance prior to taking up dive. Because the dive instructor, the dive master, in the end, if you conceal your symptoms, nobody can actually save you if you actually encounter any issues in the water. So that is the first component of being medical fit to dive. And also for the safety of yourself, and also, of course, the safety of your companion. Okay? And second component of fit to dive is to be able to enjoy your diving to the maximum. And what does this mean is, diving, recreational scuba diving, what we are talking about today, is actually a moderate intensity physical activity. Yes, you can dive. Anyone can dive. Even kids can dive. Teenagers can dive, I mean. But to able to enjoy it maximally, we would actually require a minimum of moderate intensity physical activity, and this is also to ensure that when we encounter emergency, especially strong currents, or you want to chase a school of barracudas, you actually have the extra energy to go for it.
All right, so I think that's a very good point, Amanda. I don't think a lot of people know that even recreational scuba diving is equivalent to a moderate intensity exercise. Means if you go for a brisk walk, a slow jog, even for some people, you know it's exercise. But a lot of people who go for recreational scuba diving, they don't really realize that they're actually doing an equivalent to a moderate intensity physical activity or exercise. So you do need or require a certain amount of fitness in order for you to enjoy that dive more. Of course, you can say, oh no, I'm not fit, but I can still enjoy my dive. Yes, until a strong current comes along, and then it's a different picture. So on that line, maybe Dr. Sophie, you can explain a bit more about do you think that we should, in fact, screen those going for recreational scuba diving? And if so, how should we go about it?
Okay, before I jump to the questions, okay, did you know that the average scuba diver will burn between 400 to 700 calories per diving? Okay, depending on the current, water temperature, and also the durations. In comparison, you need to jog an hour or 11 kilometers to burn 400 to 500 calories. So you can see, compare it. So imagine you just need to inhale and exhale the air, control your mind and buoyancy to burn this amount of calories. It's easy, right? Rather than go for jogging. Back into the questions. Why is so important to scream before enter diving? Okay, I'll share with you guys some facts first. So scuba as a self-contained underwater breathing apparatus is a kind of form of exercise considered as a moderate to the vigorous intensity. Like Dr. Nick Nadira said just now, maybe can up to 7 to 14 METs of energy. METs is the metabolic equilibrium for the energy of the oxygen. And you're gonna challenge yourself with the unusual environment, okay? Because of the immersion with the different ambient pressure, the coldness, and also the high external pressure, and sometimes with the low visibility and the strong current. So these things all gonna challenge yourself, okay? This thing all gonna affect our body physiology to maintain our normal hemostasis of the body. Hemostasis is a state kind of body to survive and function correctly. So what will happen to our body? It will affect our hearts, it will affect our lungs, blood vessels, and also the immune system. If I want to talk about it, it's gonna be long. Okay, and according to the DAN, the Divers Alert Networking annual report with the latest one in 2020, total number of collected fatalities that were reported worldwide in 2018. I don't know why they take it to 2018, because maybe after that, due to the MCO, less divers during that time. The fatalities is recorded was 189, okay, including the commercial divers who are workers underwater, the military, and also the public safety, all right? So out of these 189, 100 of the divers, the fatalities been recorded from the recreational divers. So you can imagine 100 of them deceased because of diving activities. And among these hundreds, 80% the descendants were male, and 67% of the age are 56 years old and above. Okay? So most of the fatalities, when did it occur? Is it surface pre-dive, or is it during diving underwater, or is it surface post-dive due to the DCS? And then reported that the highest was during the diving underwater. Okay, with the majority of the cases, number one, due to the cardiac events. Then reported that 1 out of 3 of the fatalities recorded due to the cardiac event. Second one is due to the nitrogen narcosis. We have to remember, nitrogen narcosis is different from the DCS. Nitrogen narcosis, we're gonna happen during the underwater diving, but DCS, we will notice it after the surface post dive, all right? And the other cause is out of air entanglement, and also the rapid ascent due to arterial gas embolism. Okay, so we have to understand that increasing age is a known risk factors in terms of a person's ability to cope with all increase in the physical activity load. we have to understand that our heart's capacity to support an elevated of blood output due to diving decreases with age and disease. So to have a healthy heart is the most important for the safety diving. Theoretically, I'm as a medical background, would recommend recreational divers, all the divers over 40 years old, to have a regular checkup with the doctor at least 3 to 5 years. This one, I'm using the New Zealand guideline. But by right, the AHA, the American Heart Association guideline, anyone 35 years old, even Malaysian also follow the guidelines, we have to annually make a checkup. And you have to tell the doctor that your intention for diving. Diving is different from the other sports. Let's say if you want to compare between the diving and the marathon, diving prevalence is about 16 per 100,000 of divers per year of incident of death. In between for the marathoner is about not that much, also about 50 plus per 100,000 of the marathoners. I know it's marathoner is more, but because the participant is more compared to the diving. Okay, so it is important to communicate with the doctor and tell your intention to dive, and this will allow the doctor to assess and provide you with the information that you needed. So is there any potential issue arise, we can manage your risk. And for example, why I say like this, some medications could put your heart under excessive stress to your heart. And while diving, such as the beta blockers and the anti-arrhythmic drugs, which will increase your cardiac risk while diving. Apart from that, there will be a lot of people who high blood pressure, the divers, but still continue dive because they are love and enjoy with diving. And we cannot avoid them, hey, you cannot diving. The doctors cannot tell like that. So doctors are all being prepared, okay, to accept different level of risk. So a discussion about the risk is worthwhile for your safety because some of the risk can be managed. And so informing the medical professionals so we can allow the opportunity to prescribe you with the medication to make a less restriction to your heart. And lastly, I would like to recommend and advise all the divers and for those who love to join in the diving activities, please not to take a clear physical examination while you fill up the recreational scuba council training council questionnaire, which been used worldwide. You may all clear, all no, yes, no, all be no. Okay, but actually you have some of the symptoms. Okay, so this thing is very important because when you're diving, you're not diving alone. By principle, we can't be diving alone. Even for the free dive, we can't be diving alone. So we need a buddy. So we don't want to harm your body or make your body worry, and also the dive master, because among all the cases that been reported, the dive master will also be in danger. Okay, and for your family, of course. So I pass back to Dr. Nadira for the further questions.
Thank you, Sophie, for that detailed explanation. I think that it's really quite clear that even if you are healthy or you think you're healthy, that diving or recreational diving even is actually a moderate intensity exercise, that it is a strain on your health and your body. So Amanda, maybe passing it back to you, if someone thinks that they are healthy, should they still go for screening? I mean, Sophie mentioned if you're more than 40 years old, if you have conditions, then you should highlight this and go for an annual checkup with your doctor. But what if you're young? I mean, a lot of divers are quite young, they're in the peak of health, they are fit, they have no issues. Should they still go for a health screening prior to a dive?
Hello. Thank you for the question, Dr. Nick. So as a young or presumably young individual who wants to take up scuba diving, the DEN or the diver network, they actually have a very extensive list of questionnaire which you can actually, on any individual can go through. Just go through the questions, and if you think that you have, or they think that they have the symptoms, you can just go to a normal clinic kesehatan in case if you didn't know where to go, a GP, or actually any physician, they can clear or refer to the appropriate department. So any department such as respiratory, if you have lungs issue, they can refer you to a respiratory department. A cardiac issue, they can refer you to a cardiovascular department. But actually, we also have a sports medicine department, which a normal clinic kesihatan or a public health care, they can write a referral letter, refer you to a sports medicine department. We can assess and we can refer you to the appropriate department. So if you are young, fit, congrats if you pass through the questionnaire. You can you actually pass through your diving certification and you are ready to dive. But to actually enjoy or to answer the fit to dive theme, ACSM, which is American College of Sports Medicine, WHO, they actually recommend 150 minutes of physical activity, moderate physical activity per week, or 75 minutes of vigorous physical activity per week for optimum health physical activity. So physical activity, the term is actually very confusing because it's interchangeable with exercise. But physical activity is something that we do every day, just involving bodily movement. Whereas exercise is structured, planned, repetitive, and it actually has an end goal. So why am I actually emphasizing on this is because by both the physical activity and exercise helps to transport oxygen, help our body to utilize oxygen, and this is good for scuba divers because we have more oxygen in the tank. Okay, so sometimes if you see that in the strong current or when you're swimming when you are kicking in the water and you realize that you're using a lot of oxygen, a lot of bubbles is releasing, it's because maybe you're not that fit although you are partaking in a scuba diving activity. So if you are optimizing your physical activity, like I said, better oxygen transport, you can actually lower your heart rate, more effective blood pumping throughout your body. And lastly, also, of course, you wouldn't have that much cramps because you will clear up being active or being physical active. You can actually help to clear up your lactic acid accumulation in your muscles. So probably lessen the cramps as well. Unless you are a dive instructor, dive master, or inside the occupational diving society or the industry, which means that you are actually diving 2 to 3 times minimally per week. I would suggest that you can partake in physical activity or exercise while waiting for the next scuba diving journey so that you can actually enjoy your dive more. Thank you.
All right, thank you, Amanda. I think that's a very, very nice and prompt. I think it's apt description from Amanda. It's trying to say that yes, scuba diving is not without its own risk, but while scuba diving itself can make you more fit, unless you are regularly going down for scuba diving 2 to 3 times a week, and you think that you can achieve that, unless you're a dive master or SI scuba instructor, then maybe yes. But if you're the normal person just going for scuba diving for recreation 1 to 2 times a year, if you want to enjoy your dive better, have less risk of injury, less risk of fatalities, then it's definitely the better thing to do to ensure that you have at least adequate fitness to enjoy your next dive. All right? I think that's about all the time we have. I think they gave us 20 minutes. We're about there. Any last questions? Any questions from the crowd? I don't think you can do a Q&A, but we are actually also here in booth B44 on the left side of the hall. If you want to ask a bit more about how can you assess your own fitness, or what kind of fitness do you need for scuba diving, or how to know whether you're fit or not, those kind of questions, feel free to find us on the left side of the hall. And if not, I think we'll wrap it up until here. A big thank you to our invited panelists, Dr. Sophie and Dr. Amanda. And I hope you have a nice time here in the expo. All right. Assalamualaikum warahmatullahi wabarakatuh.
Thank you.
Thank you.